Welcome back. Imagine calling your doctor's office and you get this message.
Hello, you've reached the doctor's office. I'm sorry, the doctor can't see you today. He's on strike.
Yeah, and once Obamacare kicks in, that could soon be a reality. Many in the medical community are finding it will be harder to continue offering the same quality of care, so could doctors be driven to unionize? Let's get reaction from Senator John Barrasso, chairman of the Republican Policy Committee. He's also an orthopedic surgeon. He's not on strike yet, though. Good morning to you, doctor.
Good morning.
Okay, so with the Affordable Care Act, it's facing doctors to work in large part. They're not going off on their own so much. They're working for large doctor groups and other organizations, which means essentially there's service personnel, which could lead to unionization. Do you believe that could be a possibility?
Well, I think we're going to see more and more of that in some states more than others. I know they're looking that way in Connecticut. But what you're seeing is more and more doctors are actually having their practices bought up by hospitals. Right. Amazingly, the government decides to pay different prices whether the same thing is done in a doctor's office or done in a hospital. They pay a lot more in a hospital.
Sure.
So hospitals are asking doctors to come join them, but it's going to be almost like a bigger and bigger medicine and less of the individual patient-centered care that people want. This
Sure.
healthcare law is is driving up costs, and I believe is driving down quality and also available care.
Sure. So one day doctors could unionize. I want you, doctor, to weigh in on a front page story on the Wall Street Journal about how apparently a number of unions want out of Obamacare. It wasn't supposed to happen that way.
No, these are the unions that actually lobbied for and supported the president's health care law. As one union member said, he said, I saw the president say, if you like your plan, you can keep it. Now I'm finding out that I can't. The president promised insurance premiums would drop by about $2,500 a family by the end of his first term. That hasn't happened. Prices have skyrocketed, and now unions are saying, hey, we can't afford health insurance coverage for these employees, these members, under the president's health care law, because the president's health care law essentially has made it worse.
Oh, man. Meanwhile, let's talk a little bit about a big story down in Washington. Federal appeals court said that the Obama administration broke the law when they tried to make some recess appointments to the National Labor Relations Board during what wasn't a recess. They said you can't do that. Now, you've come up with a bill that's going to undo some of the damage they've done, right?
Well, yes, this National Labor Relations Board, these recess appointments, the illegal, unconstitutional recess appointments had been made over a year ago. These guys have come out with over 200 rulings, and they say they're going to keep coming out with more rulings until this actually gets appealed to the Supreme Court. I have legislation that actually stops any additional rulings by this group. They're right now operating under a cloud of uncertainty.
Sure.
And for all the businesses and folks around the country that are being subjected to these rules and regulations, I think they're all going to get thrown out once the Supreme Court finally rules.
And that could take years, and that would just be a big fat mess, wouldn't it?
Well, it's a lot of the things coming out of this administration that they go way beyond what the law allows. And that's what we're seeing here with these illegal, unconstitutional recess appointments made by President Obama.
All right, we're going to be keeping an eye on your legislation. Dr. Barrasso, we thank you very much for joining us today from Capitol Hill.
Thanks for having me.
Thank you, sir.